Hey, Dr. T. So, we do stem cell stuff around here, and I'm really thinking about like saving my placenta when I have the baby. And can we use that like for patients?
Actually, no.
Why not?
Well, it's a little complicated, but there is this whole thing where you can store your stem cells, your baby stem cells, for future use for your baby. But when we use the mesenchymal donor stem cells from placentas, there's actually a very complicated process in which they grow that up in the lab. And we use a company called BioRenew Therapy that actually does that they grow those cells up. So it doesn't really work that way. But gosh, that would be nice.
Well, still, I can't wait to learn about more.
I know. Cool. We'll be right back with the Naked Doctor talking about stem cells today. Hi, welcome back to the Naked Doctor. This week I'm Dr. Tammy.
I'm Lauren.
And we're talking about stem cell therapy today.
Stem cell therapy. I love stem cell therapy. So many different things that you can use it for.
It's crazy. And there's a lot of buzz. There's, unfortunately, it's a whole industry where insurance doesn't want to cover it because they don't want to cover things that work. Yeah, exactly. And so, a lot of people are really resistant and they're like, why don't my doctors tell me about this?
Yeah. Well, and it's, one of those things I feel like that stem cells actually eliminate is surgeries, because sometimes people are like, oh, I got to get this knee surgery, this ankle surgery, this back surgery, which I don't know if I've ever heard of anybody that I've ever talked to is like, oh man, I've had a really successful back surgery one time. I just don't. And, and I'm not that I'm saying that there haven't been any, because most of the time I guess I'm dealing with people who have pain points, still, but it's just one of those things that I feel like can help so many people in so many ways and eliminate having to get that 1, 2, 6 surgeries later on an issue that really never gets resolved,
Well, and one of the issues too is that when someone has, say, back surgery, they're having like metal rods put in, and that's decreasing the range of motion, and it may be helping the joint space, but it's not regenerating. It's not healing the ligaments, the tendons, the blood vessels, the nerves, all the things that were causing the pain. And in fact, they have done studies at autopsy showing that people who never complained of back pain their whole life have this pathology with these different, joint issues and what we call arthritis in the spine and things like that, that actually it's found at autopsy, but they never really complained of pain. And case in point, I have a really severe scoliosis, a very crooked spine. It causes me absolutely no pain at all. So just because you have something on x-ray or MRI or you have something wrong doesn't mean you necessarily have pain, and vice versa. Just because you have pain and they go in, they try to fix the thing they think they see that should be causing the pain, that may not be the thing causing the pain at all. It could be the nerves, the tendons, the ligaments. It could be something
inflammation
else. Straight up inflammation. And that's what we do all the time, is we help people find the underlying cause. So we deal with leaky gut, we deal with hormone issues, we help people with the things, educate them about what causes inflammation. So not only do we do stem cells, but we also look for the ongoing insults that cause the inflammation, that cause the pain.
Yeah, because it's kind of like when you talk about with hormones, how removing the ovaries and stuff like that doesn't eliminate the issue that was causing where the hormone imbalance was. I was talking to a patient today about, she said something about a tummy tuck. I was like, well, a tummy tuck is not solving the issue from the root of what's caused. And it doesn't mean that you aren't going to blast through that tummy tuck and have to want another tummy tuck. You know what I mean? So stem cells, it's the same thing. It's like in surgery, if you are taking something away or doing some kind of surgery, it's like you're not dealing with the underlying cause that may have caused the issue to begin with, or like you said, it might not even be that issue. So there's so many different things that stem cells can do, and that we, it's crazy how many different things that we help people eliminate pain from, that you would you would never know, like that they may have, it's like they were going to go get surgery, like, next week.
Yeah.
It's like,
well, I have a good friend that I hadn't talked to on Facebook in a while, and it was last year this time, reached out and he said, happy birthday. It was on my birthday, and he said, hey, how you doing? He said, I'm getting ready to have bilateral knee replacement. I'm like, dude, before you do that, why don't you come see me and let me do stem cells?
Yeah.
And he flew down from Chicago. He was pain-free, canceled his surgery, and I have a million stories like that. It's just crazy what it can do when it heals and regenerates. And unlike steroid shots, people are like, well, I'll go get my epidurals or my steroid injections in my joints. That actually tears the joint down. This actually heals the joint, rejuvenates it, heals the matrix, the collagen, the ligament, the tendons, everything in there.
Yeah, I know. I hear about people getting cortisone shots, and it's like, well, that's just your first cortisone shot of many that are you're going to have to get to eliminate the pain that actually is only perpetuating the problem. Is going to cause even worse pain in the long run.
Right.
Yeah.
So we were going to do a short segment here, right? So we probably need to take a little break. We'll be right back with the Naked Doctor. Hi, welcome back to the Naked Doctor. This week I'm Dr. Tammy.
I'm Lauren.
And we're talking about stem cell therapy.
Yep, stem cell therapy. And there's not just one kind of stem cell therapy. There's actually a couple of different kinds, which is something I know that people would love to hear about.
Right. Well, a stem cell is basically just that. It's a stem. It can become anything. It's what we call a pluripotential cell. It can differentiate and it can become ligaments, nerves, blood vessels, anything, joint spaces. Also, it can help rejuvenate collagen. And one of the things I first learned about when I was learning about stem cell therapy was the vampire facelift. So it can rejuvenate collagen in the face. It can be used for cosmetic procedures. It's, it's just so multifactorial. And normally what we do is we use something called platelet-rich plasma. So there's a couple different places that you can get the stem cells.
AKA PRP.
PRP. So platelet-rich plasma comes from the blood. You can also get stem cells. These are the cells that come from the bone marrow and can become anything in the body. You can get it from the bone marrow directly, but that's pretty invasive, and you have to do a bone marrow. You have to put a needle into the bone marrow and pull that out, and it's painful, uncomfortable, has risks of infection and things like that. So, and it's just as effective getting it from the blood, because what happens is the stem cells come out of the bone marrow into the blood, and then we spin it down in a specific process and then pull that platelet-rich plasma, a little layer just under the buffy coat when we spin the blood down, and pull those stem cells out, and then we can inject them back in.
If just taking the blood and putting it in the centrifuge and doing that is as effective as taking it from the bone marrow, then why in the world would anybody ever take it from the bone marrow? That seems like a painful procedure that has like recovery time that is unnecessary.
Yeah.
Why do they do that?
Well, it's much more concentrated. It's like a fresh supply, much more concentrated from the bone marrow. But if you are a younger adult, we usually like to use the cutoff at about age 50 or 55. If you're a younger adult, it's pretty concentrated in the platelet-rich plasma. So it doesn't really make sense to do that. If you are a cancer patient, then that is going to get some serious chemotherapy, which is a whole nother discussion, right? We're not even going to go into the chemotherapy issue. But if you are a cancer patient that's going to get poison, basically, what they do is they do pull off the bone marrow stem cells, grow them up in the lab, multiply them out, give you the poison, basically kill you, and then put your stem cells back in.
But do you feel like if they just did the stem cells back in without doing like the chemo and stuff, do you think that would be something that would help their issue? Like
probably. Yeah. Why even the chemo, right? But however, because they do have cancer, there's different things that they have to do to the stem cells to,
I was wondering, like, make it like kind of almost clean it out.
Yeah, clean them out. Yeah, exactly. Which is why we use something called mesenchymal stem cells or donor stem cells that come from placenta tissue, which is what you were talking about from placenta. And
I'm keeping my placenta. So,
and what they do is they take those stem cells, they grow them up in the laboratory, and super concentrate them. So it's not so much that they're really that much fresher. Stem cells are stem cells. They're blank slates, but they are much more concentrated because of the way they grow them up in the laboratory.
So basically, something that I've heard is that the potency of, let's say, the mesenchymal, which is the stem cells that come from the placenta, is what, like 40 times the potency
much more concentrated
of our PRP stem cells. But it's not like everybody really even needs that. You know, I know like that people who are maybe who are older would do better from mesenchymal. Not that they would necessarily need mesenchymal, but I know that also maybe an issue that was worse. You know, like maybe if there was like a bad tear or something, like maybe mesenchymal. Because is it or is it not true that mesenchymal will actually regrow a tooth?
Well, we're talking, that's embryonic. So an embryonic stem cells that come from embryos is different from the placental ones.
Oh, okay, good to know.
But yeah, I mean, potentially if you put something in a petri dish and, you know, it has some different growth factors to make it grow into different tissues, you can absolutely direct that to become anything. Yeah. You know, it's funny, I had a patient that was a cord dissection. He'd been in a car accident and basically his spinal cord was severed, totally paralyzed. And one of the top-notch neurosurgeons in the country was poo-pooing stem cells, which is crazy to me. It just speaks to how the pharmaceutical and the insurance companies have gotten their hooks in, you know, our medical community and in our, you know, patient community. And he told this patient, he's like, oh, you don't want to do stem cells, you could grow a tooth in your spine. And that's just ridiculous because it's not embryonic stem cells, it's adult stem cells.
Well, even embryonic stem cells is not going to grow a tooth in your spine. Your stem cells still know what to form in the where they are. Right. So it's not like you're going to grow an ear in your mouth.
Yeah.
That's pretty funny.
Still signaling factors.
That's it's a pretty crazy thing that somebody would say that without, like, you know, and especially a medical professional.
Without be top notch, you know, like gone through neurosurgery.
Yeah, you don't want to grow an extra eyeball. It's like, no, actually, that sounds kind of fun.
And that guy actually got therapy. He's doing absolutely amazing, and
that's beautiful.
Yeah, it is beautiful. So we've had so many success stories.
Oh, I know. That's one of the things I wanted to talk about is another cool thing that I've seen consistently with some of our patients is that it's been helping with Parkinson's and the tremors with Parkinson's and stuff. And I have watched, you know, one of our patients go from, I mean, he has lost like 50 pounds. He came in on a cane, could barely walk, could barely talk. He was shaking. And I'm like, he is a new man and a new person. And it just makes me want to cry every time I see him. And I come give him a big hug. I'm like, oh, you look so good. And he's just doing awesome from the stem cell therapy, from the stem cell IV. Yeah. So what's up with that?
That's why we do what we do. I mean, that really is the stories that keep us going. One thing I did want to mention before I talk about that just a minute is, so sometimes people are like, why wouldn't you just do the mesenchymal? There is actually a benefit to doing the PRP or your own, because there's also in the blood, in that platelet-rich plasma, are anti-inflammatories. That platelets that actually serve as anti-inflammatory agents as well.
That you wouldn't get with mesenchymal.
Yeah, and there's chemotactic factors that actually tell it what to become. So, you know, there's a benefit, and sometimes I will do both, and that's why, because people will be like, why would you even use your own? But there are benefits to that, getting it from the actual person and using the donor as well. And so I have young people who say, I want both anyway, right out of the gate. It's a little more expensive to do the mesenchymal, so anytime we can just use the person's own, it's, you know.
Yeah, it's something to try at least, and to see if it,
absolutely,
you know, to see what kind of help it could do for you and what good it could do for you, and then, you know, go up from there. But yeah, so the Parkinson's.
So Parkinson's, yeah, basically what we do in those cases, like any kind of brain things, because what happens is getting medications and things to cross something called the blood-brain barrier, where it actually gets in the brain where it needs to, for like traumatic brain injury, or, you know, things like multiple sclerosis or things like that. Basically, it's not getting, the medicines aren't getting up into the brain, and so they take these meds and they don't get better. Especially with Parkinson's, they take meds, don't get better. And what happens is these mesenchymal baby stem cells go into the bloodstream through an IV, past the blood-brain barrier into the brain, and the area of the brain that doesn't produce dopamine correctly, which is where in Parkinson's, the tremor comes from. So what happens in Parkinson's is when you're supposed to be at rest, you're moving. and when you want to be moving, you're at rest. So you get this rigidity, and it affects also the cognitive function as well, because dopamine is a neurotransmitter that makes you feel happy. So they're extremely depressed. They can't move, and when they try to move, everything's
right. It's like you're fighting your brain. The outside and the inside are fighting each other, which is kind of exactly what shows. The tremors and all that stuff. That it seems like exactly what's going on.
Yeah.
So the stem cells allow. So it gets into the brain.
And it regrows those areas that make the dopamine.
Okay, cool. Another thing I've seen people do is, and we have some patients who do this, is they breathe in the, I forgot what you call that. What do you call that?
Nebulizer.
Yes.
It kind of breaks up into aerosolized particles, and it actually goes back up into the lungs, so we can treat lung disease, COPD, asthma, bronchitis, all sorts of things.
I know a lot of people the patients that we have with COPD swear by that, and they absolutely love coming in to do that.
We got a couple that come from Oklahoma once a month.
Yeah, they're so sweet. They just sit there and do that for like 30 minutes or whatever.
And actually, they would get better, because it's like, well, if it worked so well, why would you have to keep repeating it? But I don't think they quit smoking. So.
Oh. Well, and they say it helps them. I mean, it's kind of like one of those.
Damage in there.
Yeah, and it's kind of. It's kind of one of those things. It's like, it's not like it's a complete, just like doing your hormones, it's not like you stop. You're like, oh, okay, I'm all good, and stop taking everything. No, you stay on a consistent regimen that keeps you, on track, which is far better than being on the track of, let me take something, and have to take a million pills to get rid of the side effects and all that stuff. Yeah. So it's like it's keeping you at, efficient and at the minimum of what you could possibly need to feel good and to be happy.
And it's your own body. There's no side effects. There's nothing that can.
Well, side effects are just whatever's going on in there.
Right. Exactly.
Yeah, but it's pretty cool. It's a pretty cool procedure.
And I will say most things are one and done. Like the mesenchymal donor stem cells, usually it's just one injection, like in the back, and it's done. And within about 2 weeks, you have pretty much pain-free if that's the way it's going to go, and I haven't had anybody not have just tremendous results. But, there are a few things where we do repeat treatments, like for hair regrowth or for erectile dysfunction, we can do injections in that area. If we're doing for incontinence or female or, bladder incontinence, usually you do anywhere from 3 to 7 treatments. So in those cases, it's, set the expectation, that it's going to take more than one treatment. And then you tell people one and done, and they're like, if it doesn't work the first time, they're like, whoa, what happened?
Right.
So it's just, you gotta educate.
Yeah, definitely. And everybody's body's different, and the way that people react, just like anything else, the way you respond, the way you react, the way your body takes in any kind of, whether it's your own stem cells or some, foreign substance, whatever the case, it's like, it all depends on you and what your issue is,
right.
So, everybody's different, but as long as you're, like you said, we educate them and don't give you any false expectations,
right.
But yeah, it's been great. It's been great results, and like I was just seeing people's lives change, and I just absolutely love it. It's beautiful.
Oh yeah. I had a patient not too long ago, and he could barely walk, drooling, just couldn't write, just pretty much given up, and he was a high-end Walmart executive, and I was in a Mexican restaurant down the street one day, and I saw this guy just kind of zip by, and I'm like, who's that?
You're like, no way.
No way. And it was him,
wow.
So it's like,
That's awesome.
It's just, it's just so many stories over and over and over again of just amazing, results.
Success stories, yeah.
Well, and I've been doing stem cells almost, 9 years now. I wouldn't keep doing it if it didn't work,
right.
If it didn't work really well, because it is a little bit of an investment, and I certainly, authenticity, integrity, I would not take people's money if I didn't see amazing results, and if I truly didn't believe in what I'm doing. So it's pretty powerful.
Yeah, I love it. I think we need to take a little break.
Okay, time for a break. We're going to also show a little segment, somebody talking about
so we've got a Parkinson's patient who I spoke to, and it's the one I was talking about, who just his life is totally flipped around. So we get to talk to him next. So
awesome. We'll see you right back here on The Naked Doctor. Welcome back to the Naked Doctor. We have a great show. We are talking about stem cell therapy. A lot of buzz around that. There are some people that are cropping up different practices and stuff doing it around. You know, I would also advise people that there are people charging a lot of money for this too. I had a woman come in one time, almost $15,000, and her investment to these people was no better. And you know, she's like, I wish I'd found out about you first.
Yeah, I know.
So those are those sad stories. So I would say it would be well worth your time to make sure your resources, the investment, not that you're looking for the cheapest, but you don't want to be taken advantage of, because this is a really new frontier.
Yeah, and something that's cool that we offer is with some of our programs, we have unlimited stem cell therapy for the duration of your program, which is like unheard of and really cool and so helpful for people, especially depending on what your issue is. But yeah, I know we talked about before the break about the Parkinson's patient, and I just talked to him, asked him some questions about his process and what he's gone through and how he feels now. So let's check that out.
Okay, awesome.
Well, I had congestive heart failure, I have Parkinson's, COPD, GERD, lymphedema, thyroid. I usually have the list in front of me. I even had gingivitis, but don't have that no more. It's went away. When Dr. Tammy saw my medical records and saw the page full of drugs that I was taking for all my conditions, she said she could pretty well take care of everything that I had going on with me. And I've already been studying those stem cells for a long time. So I decided at that point in my life that I was on walking cane, I was falling and hurting myself, and tremors, couldn't talk very good. I had the masked face and drooling, the whole 9 yards. Since then, all that has subsided since my first stem cell treatment. I had 12 specialists I was going to. I had all these specialists, and all they kept doing was pushing more drugs down me. And the drugs cause enough problems as it is. And some of the Parkinson's medicine I was on is horrible. I'll never take it. And that's why I was to a point. Life wasn't worth living if I was going to keep going downhill, because I'm not going to take that stuff that messes with the chemicals in my brain. That's one reason why I decided, to go ahead and, hey, what have I got to lose? I'm going to try the stem cells. And I don't regret it one iota. I now feel like I've got my life back. Well, I was 45 pounds heavier than I am now. My balance was bad. My dementia was getting worse and worse. I couldn't remember from one second to the next. The Parkinson's symptoms had picked up on me and was really starting to accelerate. But it has relieved all that. I have no pain like that, because that's muscle contractions. The excessive slavas went away. My hearing's actually improved. I got my smell and taste back, which I haven't had for 15 years. And when it comes back, it's like being born again. It's like for the first time I'm able to smell something again, and see whatever, and it's been remarkable in that instance. The main symptoms of tremors are pretty well subsided. It's like, I feel like what it was 20 years ago, when they were treating me for a nerve disorder. And it was only just a shaking in this one hand, on my left hand. And that's kind of where I feel like I'm back at. And so many of the symptoms, I'm on Parkinson's website, so patients like me, the Parkinson's team, and I've got to where I just started telling people about it, because it's stem cells has been a miracle to me. To me, she's been very compassionate, very, very caring, always treats me great, you know. She gives me encouragement. I really think that she has a lot. She understands a lot of stuff that I'd been studying about natural. Take natural stuff instead of pharmaceutical, because I don't care. I'm not cutting pharmaceutical completely, but most everything you take might cure what you got, but it causes something else. And so I've tried to do nothing but natural stuff. But she's been a miracle for me. She gave me my life back, and that's what I told her. I said, I went from 12 specialists down to one doctor now, and you're it. I don't care to go to anybody else.
Yeah, so there you have it. His journey has been awesome, and he's a changed man, and it's beautiful. It's a beautiful thing to see. So
we love changing lives. You know, somebody just said to me the other day, it's so great that you guys really go outside the box to help people in a very different way. You know, I always say, if you always do it, you've always done, you always get what you always got. So we do things very differently, and I love that approach.
I love the way you just said that too.
Oh, I'm just going to roll that off my tongue. We'll be right back with the Naked Doctor. Thanks for watching this week. It's been a great show talking about stem cell therapy, donor stem cells, what we call autologous or using your own stem cells, and all the benefits, recovery time. You know, people ask, it's quick, it's in and out, you don't even need a driver. We usually, watch you pretty closely during the procedure, but you pretty much go about your life, the same day. Mm-hmm. And so there's really no downtime, unlike with surgery and rehab and all that other kind of stuff. So, it's cool, very low risk, and
the options are cool. Like, you can either get direct injections for certain pain points, or you can do the stem cell IV, or you can do the nebulizer, which is breathing it in, just depending on what your issue is. So it's neat, and there's a lot of different ways to basically reapply those back into your body to help whatever your issue is. So
absolutely, pain, rejuvenation, collagen, aesthetics, everything. So it's great. Yeah. You can go to our website and check us out more at
healingartcenters.com. It'll be she's like trying to think of the website.
www.healingartcenters.com.
She'll get it one of these days. You can go to our Facebook, Naked Doctor Show, Dr. Tammy's Healing Art Centers, Instagram, same thing, Healing Art Centers, or the Naked Doctor Show. Message us, hit us up, go to our website, healingartcenters.com. All that great stuff. We love to hear from you, love to connect with you. If you want to book an appointment for, just hormone therapy or cannabis certification or life coaching or, any kind of healing. Aesthetics, any kind of healing. We've got specials this month. We've got specials coming up next month for aesthetics. So be on the lookout for those. Come see us.
Have a great week. Have a blessed week. We love you very much, and we'll see you back here next week on The Naked Doctor. Mwah.
Thanks for watching.